9 surprising things covered by Medicare, and 5 new things and/or changes for 2024 and beyond. Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. And today's video, we're going to go over those surprising things that people didn't know are covered. But first, if you are new to our channel, don't forget to subscribe, hit the little bell so you get future notifications when we release new videos, which is about twice a month. Tell your family and friends and give us a thumbs up. Feel free to leave a comment. If you have a question, let us know. Now, on to today's video. 9 surprising things that Medicare covers and 5 new things that are covered. Now, I'm going to start with the new things, and I want to reference the Medicare and You guide. CMS publishes a guide every year called Medicare and You. So there's one for 2024, there was one for 2023. You can download it, you can go to Medicare. We'll put a link in the description below. But on page 2, before they even get to the contents and the outline of what's covered in this 128-page document, is a listing of what's new for 2024. So we're going to go over those things. So, better mental health. Now, mental health is covered by Medicare, right? It always has been. But they're enhancing it for 2024. One of the things is that they are going to expand intensive outpatient surgeries, as well as allowing you to see a marriage and family therapist and or other forms of mental health counseling. So that's a good thing. So that's number 1. Number 2, savings on RX. RX prescription coverage, right? We're talking about outpatient prescription coverage. In 2024, there's a true maximum out-of-pocket. We call it a TROOP, right? True out-of-pocket maximum. Once you hit $8,000, you're done. Everything is 100% free, assuming it's covered, right? And we didn't have that before, so that's new for 2024. I did a video on surprising changes for Part D drug coverage. One of the other things they've been implementing changes along the way is in 2025, that true out-of-pocket max is going to be $2,000. So it's going from 8 to 2. So that's good. And we'll probably do a future video on what that looks like. Number 3, lower cost insulin. $35 is the total cost to fill a 30-day supply of insulin and under any Part D drug coverage, and there's no deductible that's applied. Now, when I heard this, I read it in the book and I thought, oh, we've had that for a while. I don't understand. I've seen this before. I had to go back to all the guides. In 2021, they actually added the savings program, but not all drug coverage had it. So it was a savings plan that might be available on some plans that participated in the program. Starting in 2024, it's mandatory that all Part D drug coverage cover insulin at $35 copay for a 30-day supply. Okay, number 4, new for 2024, vaccines. Well, vaccines have always been covered. I don't get why they list this in the front of the book. But for example, flu shots, hepatitis, pneumococcal, that's a fun word to say, and coronavirus. But what's not listed there, and something that's going to be covered in 2025, I learned this on a conference call with one of my reps for one of the insurance companies, that they're going to make it mandatory that Medicare cover antiviral meds to treat COVID. Now, are they going to cover all meds? How is this going to be covered? We don't know, and we'll probably do a future video on that, so stay tuned. But for example, Paxlovid is something you see advertised on television. That is designed to treat COVID, people that get COVID, especially those that are at high risk to be hospitalized or have a severe side effect for that. So that's coming down the pipe for next year, 2025. The last change I'll highlight here, and there's more in the book, is telehealth services are changing. So we saw a big move towards telehealth during COVID, right? But there were also, they're going to continue offering telehealth services through 2024, but they're making some changes for next year. So be aware of that, and you can take a look at the guide. Those are the 5 new things. Now, let's get on to the fun things. The 9 surprising things that are covered by Medicare that a lot of people didn't know. And maybe you did know, I don't know. Let's start with something that I think is controversial. I did a video on what's not covered, and there's some fine lines in the description here, but let's go over hearing, vision, and feet, because hearing exams are covered, and the verbiage that they use is it covers a diagnostic exam, diagnostic, once per year if your doctor orders it, to see if there is a medical treatment. What's not covered are hearing aids. So hearing aids are not covered, and the exam to get fitted are not covered. But they do cover an annual diagnostic exam to look for medical problems with your hearing. Vision. I talked about this before, but under the preventative benefits, and Medicare does cover a lot of preventative services, they're going to cover an annual glaucoma screening once every 12 months if you're at high risk. What's not covered are exams to get glasses and exams to get contacts. So what they're covering is they're looking for diseases. Glaucoma is considered a disease, and it's treatable and covered under Medicare. Number 3, surprise, foot care. Medicare does cover a yearly exam or treatment if you have diabetes-related foot problems, right? If you have lower nerve damage in your legs and you are at risk of losing a limb. That's one thing. The second thing is if it's medically necessary. Those are the words they use in the guide. Treatment for 1, foot injuries, right? If you injure your foot, that's going to be covered. And diseases. So what's a disease? For example, hammer toe is one. Another one is bunion deformity. And a third one is if you have a heel spur, because a heel spur is actually a condition that can affect your walking. You're in a lot of pain. So those are the types of things that are treated. There are other things that are not treated, but that is the foot care that is treated. Chiropractic and acupuncture. Number 4, surprise. In my other video, I know I talked about some of the services are not covered, but what is covered is the manipulation of the spine to treat subluxation, or correct subluxation is what they call it. And what's interesting is I had mentioned before that acupuncture is not covered, but it is under one condition only, and that one condition is lower back pain. Now, some people go to an acupuncturist because they want to have better chi, or they have allergies, or they have a skin condition. It's been a treatment that's used for a wide range of conditions. But the only thing Medicare covers for acupuncture is lower back pain. So that is allowed. And some people are surprised to hear that. Number 5 out of 9 here, bariatric surgery. So, an example is gastric bypass surgery or laparoscopic banding, where they put the band on your stomach. That is covered by Medicare. They do. And I've been in the business long enough to remember a time when those types of services were not readily available and or covered. Number 6, surprising thing covered by Medicare, counseling to prevent tobacco use. So they do allow you, if you're trying to stop smoking, you do get up to 8 face-to-face visits in a 12-month period for that type. And I'm sure there's limits on this, but this is counseling to help you stop smoking, and prevention. Number 7, you're going to be shocked at this, eyeglasses. Wait a second. I know you're sitting there going, Kathy, you just told me they aren't covered. That is true. There is one exception, that Medicare will cover 1 pair of eyeglasses with a standard frame, nothing fancy. You can't go out and get the designer kind. after each cataract surgery. So what's cataract surgery? Well, there's a lens behind your eye and it goes bad, right? And it happens with old age. And cataract surgery replaces the lens. And it's very common. A lot of people get this done. And oh, by the way, Medicare covers that. What Medicare doesn't cover is if while you're having the surgery, do you want to have the corrective lenses so that you can see better close up or far distance? Just getting the cataract surgery replaced, you still need glasses if you're nearsighted or you can't see and you need readers like I do. If you get the cataract surgery and then it therefore causes your vision to change, Medicare is going to pay for one pair of standard frames eyeglasses. So that was something new, and I actually just learned that myself, so I did not know that. Number 8, sexually transmitted infectious screening and counseling. What are we talking about here? Well, people over 65 are still sexually active, and if you get chlamydia, gonorrhea, syphilis, hepatitis B, there's going to be screening and testing and, oh, by the way, counseling for that as well. So bet you didn't know that. Number 9, now we're at the last thing that is very surprising that people don't know is covered. We know, well, let me start by saying we know that outside the US, Medicare doesn't work, right? Medicare is the US government program for people age 65 and over, but it does cover not only the 50 states of US, but it also covers the District of Columbia, Puerto Rico, the US Virgin Islands, right? That's part of the US, Guam, the Northern Islands, and oh, by the way, American Samoa. So if you plan on visiting the US Virgin Islands, you're covered. If you go outside of that, anywhere in that list, you're not covered. Okay, so it includes US and some US, Puerto Rico is under US, and so is the US Virgin Islands and American Samoa. So those are the 9 surprising things that I bet you didn't know were covered by Medicare, and some things I learned too, and the 5 new things that are going to be covered starting in 2024 and beyond. And again, if you need a reference of what is and isn't covered, please feel free to download the Medicare and You guide. You can go to the website. We'll also provide a link. We hope you enjoyed this video. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.